Crystal, and this is my presentation on Alzheimer's. What is Alzheimer's? Alzheimer's disease is the most common form of dementia. It accounts for over 60% of all cases. It is a chronic neurodegenerative disease characterized by neurofibrillary plaques and tangles in the brain. One of the hallmarks of AD is the extracellular accumulation of amyloid beta proteins in the neuritic plaque. The clinical presentation of the disease depends on the area of the brain that is affected. The classic features of AD are progressive loss of memory, deterioration of language and other cognitive functions, decline in the ability to perform activities in daily living, and changes in personality and behavior and judgment dysfunction. The number one goal is assessment. There are many things that can cause an older adult to have delirium, which cannot be confused with dementia. Delirium can be reversible. Common causes are inadequate or inappropriate pain control, fecal impaction, medications, infections such as urinary, respiratory, or skin, hypoglycemia and hyperglycemia, fluid and electrolyte imbalances, hypoxia, and head trauma. Memory loss is not a part of aging. The individual's assessment should include functional, cognitive, and behavioral queries and observations. The family may be interviewed after the patient so that the healthcare team can better understand the patient by clarifying, elaborating, and validating information with the family. Cognitive assessments can be done to determine the severity of the disease. The component of the mental status evaluation includes the following: orientation to person, place, and time, attention and concentration, ability to attend and concentrate, memory, ability to register, recall, and retain, judgment, ability to make appropriate decisions, executive control functions, ability to abstract, plan, sequence, and use feedback to guide performance, speech and language, ability to communicate ideas and receive and express a message, presence of delusions and other hallucinations, mood and affect, which are subject and based off of self-report status. Alzheimer's is the fourth leading cause of death in adults after heart attack, cancer, and stroke. It is estimated that 14 million Americans will develop AD by 2050. The current economic impact of Alzheimer's in America is exceedingly high. The cost of medical and custodial care is $100 billion a year. Another $33 billion in work hours are lost by the caregivers. Part-time home care and other costs are paid for out-of-pockets of caregiving families, which average $12,500 a year. The average lifetime cost per Alzheimer's patient may be more than $174,000. Individuals with dementia are stressed about how they act. They may not want to be around many people to communicate in fear that they may say or do something that they may embarrass them. The behavioral changes happen both early and throughout the stages of AD. The behavioral changes may include depression, anxiety, and irritability. To detect the behavior and decrease the level of stress on the individual, a regular assessment and monitoring should be done. This will help identify triggers of disruptive behavior and early manifestations of the behavior. This will result in de-escalation of the behavior, in which return will help maintain functionality and safety and decrease the level of distress on both the patient and the caregiver. A way to assess the patient is to ask them about their levels of restlessness, anxiety, and irritability, because this may manifest before cognitive changes. Aggression, wandering, delusions, and hallucinations can be managed with pharmacological and non-pharmacological treatments. Up to 50% of individuals with AD experience depressive symptoms. These individuals need to have a geriatric depression scale screening as well as neurological testing to assess the disease of the brain. This can help provide detection and support for the caregivers and family. These stresses can occur at any time and can be lowered with progressively lowered stress threshold. There are 6 essential principles. Maximize safe function, use familiar routines, limit choices, provide rest periods, and reduce stimuli when stresses occur, and routinely identify and anticipate physical stressors such as pain, urinary symptoms, hunger, and thirst. Provide unconditional positive regard. Use respectful conversation, simple and understandable language, and nonverbal expressions of touch. Use behaviors to guide activity and stimulation. Monitor for early signs of anxiety, such as pacing, facial grimacing. and intervene before behavior escalates. Teach caregivers to listen to the behaviors, monitor the language pattern, like repetition, jargon, and behaviors such as rummaging. That might be showing how the person reduces stress when needs are not being met. Modify the environment. Assess the environment to ensure safe mobility and promote wayfinding and orientation through cues. Provide ongoing assistance to the caregiver. Assess and address the need for education and report. Alzheimer's disease is one of the most critical, unaddressed public health issue in America. The Alzheimer's Association is leading advocate for individuals with Alzheimer's. The Alzheimer's Association is trying to get more investment from Congress so that they can help ease the economic and emotional toll that AD takes on families and the nation. The research on Alzheimer's is a national priority. This is because the baby boomers are getting older, which means that there may be an increased amount of Alzheimer's disease. There is no cure or preventative treatments for AD, and are no disease-modifying drugs to stop, delay, or reverse progression of AD. No national plan has been formed to combat AD, which is a worry because the cost of AD care and services are rising. This could threaten to bankrupt Medicare and Medicaid. It is estimated that in the next 40 years it will cost the U.S. $20 trillion in Alzheimer's health care, not counting the human toll it will take. Every spring, the Alzheimer's Association Advocacy Forum meets in Washington, D.C. to try to pass legislation. The Alzheimer's ambassadors serve as key contacts to Congress and have year-round meetings that discuss federal legislative priorities. The Elderly Stage Advisory Group, ESAG, work to educate state and federal officials about the need for improved research funding, care and supports programs. ESAG members attend both the Advocacy Forum and many state lobby days organized by chapters. The Alzheimer's Association Breakthrough Ride is a Coast to Capitol bike ride relay that researchers seek signatures supporting their petition to Congress to make Alzheimer's a national priority. It is best to have a power of attorney or advance directive before or soon after the diagnosis of Alzheimer's. If a will or trust is not made, it should be done so shortly after the diagnosis. If a will or trust is made, then it should be updated. It is to ensure that the individual's wishes are met once they lose the ability to be able to think for themselves. The equilibrium model can be used as early intervention. A person newly diagnosed with AD may think of suicide. They may not want to face the troubles of AD and or not want their family to have to take care of them. The goal is to help the individual recover to a state of pre-crisis equilibrium. After the individual has returned to pre-crisis equilibrium, the cognitive model can be used to help them think more positive and less negative thoughts. The goal is to help the individual become aware of and change their views and beliefs about their crisis situation. They can gain control of their lives once they change their thinking to positive thoughts. To do this, they must recognize and dispute the irrational and self-defeating thoughts and focus more on rational and self-enhancing thoughts. In the psychosocial transition model, it is believed that people are products of their genes and their learning is from their particular social environments. The goal is to collaborate with the individuals in assessing the internal and external difficulties, such as psychological, social, and environmental, that are contributing to the crisis. Then help them choose workable alternatives to their current behaviors, attitudes, and use of environmental resources. To be able to gain autonomous control over their life, they must have adequate internal coping mechanisms, social supports, and environmental resources. They may be able to go to support groups, counseling, schedule a routine, such as bathing and eating frequently, and be around people to do activities that they enjoy and exercise regularly, which is better to do during the morning. The caregivers should let the individual know that they are loved and appreciated as part of the family and will not be abandoned. Even the smallest success and occasions should be celebrated. Here are some support groups that they can go to. The adaptational theory depicts the individual's crisis through their maladaptive behaviors, negative thoughts, and destructive defense mechanisms. The theory perceives that once maladaptive coping behaviors are changed to adaptive coping behaviors, the individual's crisis will recede. To break the maladaptive way of thinking, the individual must learn adaptive behaviors, have positive thoughts, and construct defense mechanisms that will help overcome immobility and reach the positive mode of functioning. To be able to do this, the individual must have a strong support group. Early onset familial Alzheimer's disease occurs less than 60 to 65 years of age and often before 55 years of age. Less than 2% is inherited. Risk factors include mutations on PSEN1, PSEN2, and beta amyloid precursor protein. Late onset familial Alzheimer's disease occurs over the age of 60 to 65 of age. The risk factors include gene-gene interactions, carrier of amyloprotein E4, and Down syndrome. African Americans are at higher risk for developing AD than whites. The cultural adversity with older African Americans may shape health perceptions and knowledge of AD. It could also contribute to disparities in the detection and treatment of AD in this high-risk population. The Asian African subgroup prevalence is far less clear. Age-standardized prevalence rates found for Japanese American men in Honolulu Heart Program and Japanese American participants in the KIND study in Washington State were similar to the rates found in white non-Hispanics and in the Northern European samples with AD, and slightly more vascular dementia than whites. Other Asian groups are less well studied. Here's a case study. An older adult who has been in long-term healthcare facility for 6 years is showing possible signs of dementia/Alzheimer's. These signs include babbling, rummaging through things, and saying things that do not make sense, such as asking for their shoes to be taken off when they are already off and the individual is laying in bed. The individual is a Caucasian male. The individual has these periods of confusion but can also have a short conversation with others at times. This individual is a ward of the state. Is this memory loss a part of aging? No, it is not. Who should be contacted about the history of the individual? Since there is no family to contact, the nurses and other healthcare professionals that have spent much time with the individual should be talked to. Is the individual at the highest cultural risk for developing AD? No, African Americans are at higher risk for developing AD than whites. What cognitive assessment can be done to determine the severity of the disease? The mental status evaluation. What are 6 essential principles that can help lower the individual's stress? Maximize safe function, provide unconditional positive regard, use behaviors to gauge activity and stimulation, teach caregivers to listen to all the behaviors, modify their environment, provide ongoing assistance to the caregiver. In this case, would be the nurses. This individual gets angry and stressed because they are confused where they are and what they are doing. According to the adaptational model, what should be done? To break the maladaptive way of thinking, the individual must learn adaptive behaviors, have positive thoughts, and construct defense mechanisms that will help overcome immobility and reach a positive mode of functioning. The individual needs support to be able to do this.